So Nicaragua has two autonomous regions on the Caribbean side. And these are home to the largest concentrations of indigenous and Afro-descendant children in the country. They also happen to be one of the poorest, which is complicated because the country as a whole is the second poorest in the entire Western Hemisphere. So to improve the lives of children there, the two autonomous governments, one in the north and one in the south, wanted to work with UNICEF to develop regional policies for children. I must confess I was not thrilled with the idea at first. There are two things in this world that you don't want to know how they are made: sausages and policies. I don't know much about making sausages, but I know that policies follow a fairly standard procedure. First, you hire consultants who then do some kind of desk review and data analysis, often with unreliable data. Then they interview some key stakeholders, whoever they are, and then in closed doors, they begin drafting the policies, which will certainly contain a long list of best practices from other countries. So then they finalize the process by holding some kind of consultation with civil society, check, and then you validate the entire process. You end up with beautifully written policies that are, one, disconnected from reality. And I'm not talking about the reality of numbers and the high-level policy talk. I'm talking about the reality that people face every single day: mothers, teachers, children. These policies also tend to be very ambitious. So ambitious that to be implemented, they need a set of prerequisites, none of which are readily available. The first one, money, obviously. And the second one, the classic, capacity building, especially of those frontline workers who needed to implement the policy in the first place. So it's not surprising that you have a situation that the policy is not implemented at all. So to avoid that situation, we introduced a human-centered design approach to the policymaking context. And we worked with the awesome colleagues from Reboot and also from Policy Lab to adapt design tools to help these public employees think like designers. When a designer is developing a phone, for example, they need to put themselves in the shoes of the consumers they are trying to reach. They need to understand what kind of features these people want in their phone, what kind of features they don't want in their phone, and what would really make them buy the phone. So we apply the same logic for public employees, and we focus all our energy in trying to make these public employees put themselves in the shoes of the people they are trying to reach with the policies, to understand what these people wanted, what these people needed, and what they truly cared about. And understanding what these people want, need, and care about is not the same as asking what they want. And it's not the same as us understanding what they want. As Henry Ford once said, if I had to ask people what they wanted, they would have said a faster horse. So we avoided that situation, and we implement from 1 year in each one of these two regions a set of tools and methodologies that allowed these public employees to, first, relearn how to listen. 2, empathize with what is being said. And 3, make sense of that information for the policymaking context. And how did we manage the politics in this work? Well, there are many things that can be said here, but I'll highlight a few practical examples. First, we established that there would be no hierarchies and no experts. So we no longer had a planning director or an expert from the health sector. From the beginning, we assumed that we had to take on nicknames and aliases. There were a lot of superheroes in the process, by the way. But it was very simple and very powerful exercise. The second thing that we did, we established within the government a co-creation room. And this room was done up all crazy with balloons and pictures and writings on the wall. And it actually gave such a good vibe that the moment that the public employees entered this room, they sort of let go of that pretense that they had to act like experts. And they were much more willing to experiment. The second thing that we did was establish from the beginning, put people first. It was always a reminder. And I know it sounds like a development jargon, but actually it's not. It's at the heart of the human-centered design approach. So again, from the beginning, we established that the real rock stars of the entire process, the real experts, if you will, were the people that we were trying to reach with the policies, because they were the one who had a wealth of knowledge about their own experiences. So our role, both as government and as UNICEF, was only to provide the scaffold so that these people could tell their stories. And that's why when you look at the final policies, you see that even the problems had a human face. You know, after 10 months of just problem finding, these problems were transformed into archetypes that were representative of all the problems that we found in the region. So for example, we no longer talk about child labor. We talk about Maria, a young mother who sends her 10 and 12-year-old children to the streets to sell tortillas. And we embrace the complexity of Maria's story, both her obstacles, but also her support mechanisms, to design interventions that will have a direct impact on Maria, instead of creating layers and layers of interventions that may or may not trickle down to her. And how did we manage learning? Well, learning was embedded in the entire process because this whole thing was not done by consultants. It was done by the government themselves. So all we had to do was create opportunities for them to engage in immersive experiences and also create space for them to stop and rethink and process all these data that they were accumulated. And that meant, for example, just to take a page from the lean startup approach, we also adopted it's called Genchi Gembutsu approach from the Toyota way, which means go and see for yourself. So we sent a lot of these government counterparts to the field to perform shadowing, conduct in-depth interviews, run focus groups. They had to relearn how to just observe or how to take notes. We also created lots of opportunities for them to engage in service trials, you know, to test out public services themselves. And we used the 100-day, the rapid result approach to do that. So for the following 100 days, they had, these government folks had to try to register a child. They had to try to sleep in maternal houses. They had to go to schools, good schools, bad schools, do the homework, eat in the cafeteria. And in the case of men, we even had some of them carrying 30-pound backpack to simulate a day of pregnancy. And just to finalize, to quote Arlis, he's a staff from the planning sector who worked with us, and he said that this process allowed them to go from public employees to public entrepreneurs. And I don't know if it counts as learning, but I was very happy when I heard that. Thank you.